Next, we'll do with the ectopic pregnancy. So, the most common which is seen in ectopic pregnancy is pelvic inflammatory disease, and the most common site in which it happens is ampulla ampulla of the fallopian tube. So the early ectopic pregnancy happens in isthmus. As we told before, the most common place which happens is in ampulla, and the last place for the ectopic pregnancy to happen is the interstitial place of the fallopian tube. So the most common thing which is seen in ectopic pregnancy is pain. It's not bleeding or anything. It's pain, then followed by vaginal discharge. So how do we diagnose the ectopic pregnancy? We'll measure the level of HCG. If it's like greater than 1500, we would go with transvaginal sonography. If it's like greater than 6500, we'll go with transabdominal sonography. Then we would check for beta HCG level. In normal pregnancy, it would double in 2 days, but in ectopic pregnancy, it would only double in 5 to 7 days. Then we would check for serum progesterone. In normal pregnancy, it would be like greater than 25, but in ectopic pregnancy, it would be like lesser than 5. But if in case of missed abortion, also it would be like lesser than 5. Next, how do we treat ectopic pregnancy? In this also, first we would measure HCG. If it's like greater than 5000, we would go for medical management. We would give methotrexate in IM or IV, then actinomycin or ketone injection. If the HCG is like greater than 5000, we would go for surgery. We would do total salpingectomy or linear salpingectomy. If the pregnancy is not ruptured, if it didn't rupture, we would go for linear salpingectomy, or we would go for resection and re-anastomosis.